All right, great. So welcome everyone to the Thoracic medical students first foray into the Twitter space. My name is John Shuffles. I'm the current president of TSMA and a fourth year medical student at UT San Antonio. I have the privilege to be speaking with Dr. Lauren Barron, who is an assistant professor and cardiac surgeon at the Baylor College of Medicine in Houston, Texas. And I wanted to thank you guys for all coming to this talk. I think it's really important. We're going to be discussing the interview fundamentals. It's going to be a really high-level talk, and I'm excited to share this with you guys. And I want to preface this all by saying, as a fourth-year medical student, I am currently in the interview process, and so I am very vested in this as well. To get started, I want to also say that Dr. Barron is exceptionally qualified to be giving advice to us today, as she has been interviewing applicants for surgical residency for 9 years now. She began interviewing when she was in her lab years as a surgical resident at Washington University in St. Louis, and has been interviewing people since, including over 40 interviews last year, which is pretty impressive. So, Dr. Barron, do you want to get started?
Absolutely. Can you hear me all right?
Yeah, I can hear you great.
Awesome. So I'll tell you guys, I have to tell you the truth about this particular topic is that last year, 40 plus interviews, and this is also a self-serving topic because I would love to tell you how to convey information to me so that the day doesn't feel quite so long and painful for both sides. I was telling John before we started, let's face it, this is kind of about me. But in the meantime, I remember what it was like to be where you are. And there are 3 questions that I absolutely hated answering until I figured it out. And the first one was, so tell me about yourself. Hated that question. The next one was, where do you see yourself in 5 or 10 years? Or what are you going to be when you grow up? And then the last one was, just so do you have any questions? God, I just remember thinking, if one more person asks me if I've got questions, my head's going to explode. So I'll start out with, John, tell me what you think the point of your 15/30 minute brief conversation is. Like, what's the point of an interview?
Okay, that's a great question, Dr. Barron. I think importantly, an interview is an opportunity to convey who you are as a person beyond everything on paper. And it allows an interviewer to give a sense of your personality a bit too. And I think it also, can help people see through some things sometimes, like maybe some allowing people to see who you really are, I think, in an interview.
Absolutely. Those are all very serious yes answers and exactly what I would expect an applicant to tell me. But let me put it in very blunt terms, because it seems like nobody is kind of giving you guys what the blunt terms are. What happens? What do we say when there's no Zoom camera? What do we say in the meeting that happens after every interview day? And so the first point of an interview, there's 3 things that an interview is supposed to accomplish. The first one is to answer the question, do I really want to interact with this person on a regular basis? Is this somebody that I want to take a phone call from at 2 a.m. telling me about my patient with a complication? Is this somebody that I want to train to be my colleague? So the way that's the first thing that you're going to accomplish in an interview. And instead of thinking about an interview as a situation where you're going to show up and let them ask you questions and then you're going to be on the hot spot, you're not going to do that. You're going to understand that there are 3 things that you're going to accomplish, and you're going to wrap your answers around those 3 points. And if you can do that, then you've met the point of the interview. And it doesn't matter what the questions are, they're interchangeable. The first one is to prove that you are a person that I want to work with. You are a person that I can take a phone call from. You are a person that, I may not want to hang out with you every day, but if I see you on the daily, That'd be all right. So when they ask you, tell me about yourself, I want you to think back to the best talk you've ever seen, the best TED talk, the best conference talk. And I want you to think about how that person told you their point. How did they narrate their point? How did they approach the audience? Because the first tell me about yourself question is actually meant to be a monologue. It's not a time when you can like use some of the other tricks I'll give you later. This one is meant to be a story. And so the way that I recommend setting this up is understanding that this is something that you plan and you practice. It's an elevator pitch, and you've got 8 seconds to get someone's attention, because the fact is you have 8 seconds, because that's the normal attention span. And the normal,
8 seconds.
Yep, 8 seconds. And the normal English speaking person, whether it be native or not, gets about 2.5 words per second. So you've got about 20 words, which is about the length of a sentence.
Okay,
Yep,
I appreciate that framing.
Yep, scientifically, you've got about 1 sentence before I either take an internal sigh and put on my happy face, or I am actually legitimately interested. Right. And so that's why the prep work said, hey, call your mom and ask her what the most interesting thing about you is. Because often what you think is most interesting is not the most interesting thing about you.
Okay.
And so I'll tell you how I do this, or how I did this when I was in your position. There are 2 ways. You can either do this chronologically, and I do not mean give me the minute by minute from your moment of birth to now. That is not what I need. You could do it by the most interesting thing about you as a statement, and it has to be a bold statement that you can back up. And so when I don't have a bold statement right now. I have plenty of them, but none that I would say in an interview to start out with. I usually start with, I grew up in a small town where there are definitely more pine trees than people. We've got a stoplight, a 1-screen movie theater, and a lot of cows.
That got my attention, Dr. Barron.
Right. So that's the first sentence, because what I want to do is make myself a person. I painted a picture. I told a story. And you could tell me a story about living in a city. Just find something fun to add to that 1 sentence. And then the next thing that's interesting about me is that, I grew up in this little town and whatnot, and there weren't so many people who wanted to be heart surgeons. And I marched my little self into kindergarten, all pigtailed, and told them that's what I was going to be. And they looked at me like I was nuts. And my mom told them to hush and just let me go, let me be. And then I ended up in college on a cheerleading scholarship in Hawaii, which is always an interesting point. And so that I always put that in there. And then
Absolutely.
I skip through, I talk about, hey, you know what, when you're a cheerleader in Hawaii from a liberal arts college, it is a tiny bit challenging to convince people that you are a serious student. And so I did a year in the lab where I learned that I really love research. I did basic science. I worked with mice. That's my ringtone. And then I went to medical school at A&M, and then I go into residency. But I skip all of the medical school bits, because that is something common that, because we've all experienced it, isn't super interesting unless you did something different. I have a student who is an engineer. She's a nuclear engineer, and her medical school is geared towards engineers. They make physicians out of engineers. That is interesting. That I want to hear about.
Okay.
So you're going to tell me a story, and you are going to outline that story with the most interesting things on your CV. So you're going to take your CV that you have in front of you, and you're going to highlight what you think and what your mom thinks or your person thinks is the most interesting things about you. And then what you think is the most impressive things about you. And you're going to build a story that lasts less than 2 minutes and is filled with things. Less than 2 minutes, and is filled with light, fun ways to describe your story. And that's it.
So you're saying that we should have something that is both very interesting, but and impressive, but also something that might help us stand out a little bit.
Correct. And I don't need you to tell me about, if you're an Olympic weightlifter, I don't need you to tell me that you're an Olympic weightlifter that only does the back squat on your left leg on Tuesdays. I need to know, I went to the Olympics. Pause. Don't tell me why. Make me ask you why, because I'm going to ask you why. So I don't need you to tell me everything that's cool. I need you to give me enough that challenges me to listen and ask you a question, because that's how you make our interview feel like a conversation and not like I'm doing all the work.
Okay, that makes sense.
So you are going to highlight your CV for the interesting things. You are going to build yourself a story, either chronologically or based on the most interesting thing about you. It's going to be less than 2 minutes, like an elevator pitch, and you are going to practice it out loud in the mirror. And when you go on a tangent, you're going to pull yourself back in and go again. And every time someone says,
important point, I think, too, is the rambling. I think many people, myself included, are very prone to being rambling and going off into a tangent, like you said.
Right. And you're going to practice it so that it doesn't sound like you're reading me your PowerPoint slides.
Perfect. Yeah, that's so that I think that is probably by far the most common interview question.
Yes.
Right.
The other answer I've had to this question, and some of the people listening will have this in their background. I once interviewed a candidate and he said immediately, I said, what, tell me about yourself. What's interesting? And he said, I am the most resilient candidate that you will interview this year. And I said, whoa, bold. Tell me more. And he said, you know, I come from a country that's war torn, and I knew that I wanted to be a physician because my father was a physician. And the last time our village was raided or attacked, I watched my father talk down people with automatic weapons. And I was terrified for him, but more, there were 10 people in the room like me that were young, that were innocent. And his ability to stay calm in the face of something horrific it made the rest of us able to get through it. And I want to be that person.
Wow.
Right? Right. And so I didn't need to hear his monologue of life. All I needed to know was, you know what, buddy, you are right. There is nothing that surgery is going to throw at you that you cannot handle. I just have to teach you how.
Absolutely. Yeah.
Right. So if you've got something in your history that is, example, I had another resident and her story was, I grew up in a place where there were lots of air raids. And as a fourth year medical student, my job was to take a very large black permanent marker after the siren stopped and go outside and triage the patients. 1, 2, 3, 4. And if you wrote a 4, no medical person would help that person. They would move along. So if you messed up, you could kill somebody.
Wow.
Like she's like, I can handle responsibility. I have no idea what you're supposed to do with 500 different types of gauze because we only had one and we didn't have that one, but I know how to handle responsibility. So if you've got something like that in your past, and maybe your board scores aren't through the roof, or maybe you don't have the pedigree, but you've got something like that, don't make me ask you. Whip that thing out at the very beginning and tell me why you're special.
It's like the hook, right?
Right. It's like because here's the thing, whatever you come up with, that is your first 8 seconds, that is what gets repeated in our rank list meetings. Okay. You give me the words to advocate for you.
That's a very insightful way of framing it. All these applicants and participants think about.
So the next, I'm gonna move forward because now you have that assignment. The next one that we'll talk about is, so where do you see yourself in 5-10 years, and or what are you going to be when you grow up? What do you think the point of that question is?
Ooh, okay, so I think it's to see if you've introspected and thought about what you want, and to see if you have goals.
In that, yes. And do you know how unusual it is for someone to actually have fleshed out a plan, an actual plan?
Like specific?
I'll tell you how specific.
Okay.
But basically, what this question is telling me is I want to know how much intrinsic motivation this person has. How much effort am I going to have to put into this person to have them do the bare minimum that is required to become one of us? Because in an ideal situation, on a scale of like 1 to 10, with 1 being a rock star, and you just can't, you would love to pin your logo on that person because they are going places, versus 10 where you're like, well, this one I think might make it through or would make a great radiology colleague.
Sure.
And so when I interview, I think to myself, okay, how much bandwidth from the faculty is this person going to require to make them into a functioning surgeon? Because sometimes we choose to invest in people because they are going to make a contribution to the field, but we can't invest 10 out of 10 in everybody. We have to have some people that are self-starters. So that's what you are going to talk about when they ask you, what are your plans? What are you doing? What are you going to be? And the way that you need to do that is you need to think about concrete goals. What do you want in life? What do you like? When I answered that question, I answered, I want to be an academic surgeon. And I knew the reasons why I wanted to be an academic surgeon, because I knew that I was going to need both the clinical interactions and the academic push for me to feel like my job was fulfilling. If it was missing one or the other, then I wouldn't be happy. And in order to be able to do that, when I went from medical school to residency, I had to find a place that could teach me how to write an NIH grant, because I didn't know how else I was going to pay for my monies. And I didn't know how to write an NIH grant. And so I looked at the places that I was interviewing. And at that point, I was interested in pediatric surgery. And I said, you have Dr. Brad Warner, and he writes NIH grants very well, and he's a good mentor. And so I want to come here, and I want to go in his lab, and I'm going to have him teach me how to write a grant, so that when I'm done with my residency, I can have the knowledge to get started right away.
Something tangible that you were looking for, something specific, and something that you clearly thought about.
Right. And you know what? You can interchange Dr. Brad Warner with whoever they're most proud of. You look at their website and you're going to know who they're proud of. And then you take that person and you Google them and you see if there's somebody you might want to work with that you can talk about, and then you stick them in there. It's awesome.
Yeah. Yeah.
That's your prep
strategy.
Right? Or you look at their program and you say, what is this program's strengths? And at WashU, the strength was, they have a lot of variety, and they have an expert in every field. And so for me, that was great. I was like, what's awesome about this is that if I change my mind, you guys have a world expert in almost every field. There is nothing I can't do from this launch pad. And I want that kind of opportunity. So knowing what their strength is, if they're like, for us at Baylor, I would say, I'm interested in CT surgery, and I want to know exactly where the upper limit is. And if you've ever met Joe Caselli or Mark Moon, it's very clear that they live at the upper limit. And I want to know what that culture feels like. So that's the look at their website, find out what they're proud of, and figure out a way to connect it to your goals. You can literally write column A, column B, and then think about the connection.
Absolutely. Yeah. That's great. And I guess in the interest of time, I want to ask you about the question that one of the things that makes me nervous is the third question on your list is, do you have any questions?
And
from an applicant's point of view, it's very difficult, I think, because the questions change depending on who you're talking to.
mm-hmm.
And, you might be interviewing with a faculty who has really no involvement in the residency program, for example, or the curriculum or anything like that. And so how do you navigate, or from the interviewer perspective, what's the best way to go about that?
That question is how you're going to tell that program without them having to ask you, why Baylor? Why this program? Why that program? That question you are going to use to prove that you actually perused their website before you showed up, or you made notes during that hour-long thing that they all do at the beginning. And that way, when they ask you about questions, you're going to go back to that list of things I want to accomplish, things that they're proud of, because I want to learn how to do these things. And I noticed you have this thing. What's your experience with the residents being able to get involved? Or do you know if there's anyone that I might could talk to about this? Just a genuine interest in how you connect to their program.
Okay.
Because when we sit in those rank list meetings, the next question after this person's stellar, the very next question is, do you think we're going to get them? And that's where you're going to have fed me the answer to that, because I'm going to be like, oh yeah, they've totally looked it up. They even have a mentor in mind.
Wow. Okay. Yeah, that's when you understand the rank list process and you understand the thought process that goes along with that, then that makes perfect sense.
Right. We have a few minutes left, and I want to talk about something that I think everyone needs to know. Red flags. Let's go over red flags.
Yes.
Red flag. Do not describe a surgery to me unless the surgery is named after you. I do not want to know the steps of a surgery unless I ask you explicitly or the surgery is named after you. I promise it won't go as well as you think.
Okay. Yeah.
Okay.
All right. Good to know.
An interview is not the time that I want you to think about doing everything within your power to stand out. I know that seems like the goal, but you can stand out in a way that makes us very hesitant to want to put you in stressful situations, because we need to know that you can maintain your composure. So if it feels like it's going poorly, think about getting through it politically. Just get through it. Don't try to stand out, because you can have one bad interview at a place and it goes okay and it's kind of benign and it won't hurt you.
Okay.
It won't help you. But if you go off on a tangent and it gets into some place that's strange and nobody really wanted to be, that will come up and then you will not be ranked.
It will hurt you.
It will hurt you.
Okay.
If you are a person, particularly if you are a neurodivergent person and eye contact is not your jam, it is important, because not everybody recognizes that that's an okay thing. So there's a little green light on my screen right up there. And if I don't want to look at myself on this thing or look at you because eye contact freaks me out, I'm going to put something up there and I'm going to stare at it, because this is a Zoom interview and you can totally cheat. So cheat.
I've also actually heard that sometimes eye contact is even better if you look directly at the webcam, which is strange to me. So I've been trying to do that, but it's difficult.
Oh, it's kind of strange, and it's okay if you don't.
Okay.
It's totally okay if you don't. But if you're doing this the whole time, or this while you're talking, it is a little worrisome. And the reason it's worrisome is because when you talk to patients and you're telling them bad news, you're telling them their loved one isn't going to make it, or they have something hard to hear, you've got to be able to look them in the face.
Okay.
And we can work on, if you're neurodivergent and that's not your jam, we can work on that. That's something we can teach you. But you can totally cheat through the interview and it's fine.
Gotcha. Okay. Yeah, that's important. So making sure to try to look at the camera and don't try to stand out too much, and don't describe the surgery. Those are our 3 red flags so far.
So far. I'm still going. You ready?
Okay, important. All right. I'm just summarizing for our audience right now, because these are important.
The things that I hear that take someone off of a rank list in our rank list meetings: if you say something negative about another person in the field. I don't care if you cannot stand some surgeon you worked with. When you're in an interview, you never, ever, ever say something negative about somebody that you've worked with or somebody in the field, or in general, pretty well anybody. Do not pick a person to be negative about. And the reason I say that is because it's a small world and everyone is rather connected.
Absolutely. And it's just not the place to be negative at all.
So if you feel that coming on, channel your inner, I call it Sunday church lady, and bless your heart and move along.
Perfect. Okay. No trash talking whatsoever. Red flag number 4.
Yep. What else do you have? Do you have questions?
I do have one specific question. The thing that makes me nervous in our last 2 minutes, the what's your biggest weakness question? That question kind of freaks me out because everybody has weaknesses, clearly. But you want to give a weakness that is appropriate,
Yes.
while also not being fake.
No, that's absolutely. You need to look at it like a performance evaluation, not like a character. I don't want to know about your horrible fear of spiders and that you sweat on your armpits on the left more than the right when you get nervous. I don't want to know those things. I want to know that, hey, you know what? Sometimes I miss an opportunity to promote somebody on my team when I'm capable of doing the job. And the thing is I already know how to do the job. And I need to be able to focus at that point on flipping from mastering a technique into teaching and leading. And that's something that I want to work on while I'm here. And I think this place gives me the opportunity to really grow. That's what I would say.
Okay. And then at the very end, you spun it into a positive, also positive and connecting with the program.
Right. The more times that you can show them how you fit, the better your interview is going to go.
Okay. That's great advice. Unfortunately, we are nearing the end of our time, so we will not be able to take any questions from the 64 people in our Twitter space right now, which is very exciting for our first one. But hopefully we can maybe have another session in the future to, because I'm sure the audience has a lot of burning questions.
Yeah, we can certainly, and that you can also toss them out there on the website or on the Twitter space or however it is you want to toss them. And at that point, I can sort of field them. If there's a bunch of them, then we can set up another space and I can run through them. And then you can listen whenever you get a chance, or I can answer them as they come. We'll see how it goes.
Great. Well, Dr. Barron, thank you so much for your time. I know that you're incredibly busy, and this was probably the most useful 30 minutes that I have had in the last, this week at least, personally. So, thank you again for all of your help, and I'm sure that many of the attendees and TSMA members are also extremely appreciative.
Absolutely. And we'll see you next time, or I'll see you at Baylor when you interview.
All right. Thanks, Dr. Barron. Have a good night. Take care.